Just thank you, Dr. Walensky. What I'm going to do is talk about three areas. One is therapeutics. The other is a summary of where we are with vaccines. And the other is looking at some of the implications of the variants of concern that Dr. Walensky mentioned. When you think in terms of therapeutics, you think in terms of therapeutics for advanced disease and therapeutics for early and moderate disease. But also buried in that is targeting the virus itself versus targeting the aberrant inflammatory responses that often are the source and the cause of the morbidities and mortalities that we see with this particular disease. So first, if you look at the therapeutics for moderate advanced disease, one of the ones that is shown clearly to be very efficacious is dexamethasone in people who are hospitalized, who are on ventilators or have high flow oxygen requirements. It is shown to significantly diminish the 28-day mortality. There have been a group of studies such as baricitinib and remdesivir, which have received an emergency use authorization. Moving over to the left-hand part of the slide, there are a number of interventions that have been used for more early or moderate disease. For example, remdesivir, which is a direct antiviral, has received FDA approval, and a variety of monoclonal antibodies have also received emergency use authorization, as have convalescent plasma. Other antivirals, hyperimmune globulin, and things like anticoagulants are currently in clinical trial. One comment about things like monoclonal antibodies and convalescent plasma, since they are giving antibody to someone who would need a direct antiviral effect of the antibody, it is best to use it early before individuals actually have had the opportunity to progress. And that's what we're going to be seeing in the future, is an attempt to, as early as possible, get these interventions to the patients in their particular state, hopefully as outpatients, if we can logistically get that done. If we can move on to the next slide, and that is vaccines. As many of you know now, the federal government has been involved either in the development of and or the facilitation of the testing of a number of vaccines that represent three separate platforms. Shown on this slide is what we all know is the extraordinary efficacious and safe results of the Moderna and the Pfizer-BioNTech product, with 94 to 95% efficacy and a good safety profile, both having received an EUA. What we're looking at closely now is others that you see on the slide, Janssen, AstraZeneca, and Novavax, which are in various states of trial. Of particular importance that you'll be hearing about likely within the next few days to a week are the results from the Janssen J&J trial. And the reason they're important, it relates to some of the things that Dr. Walensky said. And that is, it's a phase 3 trial with a different platform, a human adenovirus vector, but it is going to be looking at efficacy not only in the United States, but also in South Africa and in Brazil. So we will get a good feel from those, I hope, I believe we will. We'll let the data speak for itself. But what we will see was the relative efficacy against the wild type virus that is predominantly in the United States, as well as the South African isolate, which in fact is something that we will be able to get a feel for the efficacy there. So we'll have some comparative efficacy, which will inform us on where we would go if the eventuation occurs that we do have that particular lineage that would take seat itself in the United States. So let me move on to the last slide, because that relates to what I said. Dr. Walensky gave you a good feel for the distribution of the various lineages, the 117, which is in the UK, the 351 South Africa, which I just mentioned, and the P1 in Brazil. She mentioned about the increased transmissibility and the likelihood of an increase actually in some lethality in the B117. The important question that people ask is, what is the impact on both monoclonal antibodies and on the vaccine-induced antibodies related to the vaccines that we are currently distributing now. When you're looking at the 117, namely what we refer to as the UK variant, what we're seeing is a very slight, if at all, impact on vaccine-induced antibodies and very little impact on anything else. So we are covered with that. Things get a bit more problematic when you go to the 351, or what we're seeing as the dominant one in South Africa, because in that regard, there is a moderate diminution, namely a multifold diminution in the in vitro neutralization by vaccine-induced antibodies. However, and this is an important however, it still is well within the cushion of protection. So you could diminish the vaccine-induced antibody efficacy by a few fold and still be well within the protective range of the vaccine. And that's the reason why you've seen announcements that actually the vaccines that we're using are still effective. However, given that as a fact now, we have to be concerned looking forward at what the further evolution of this might be. Now, I want to make one mention about the monoclonal antibodies because they are more seriously inhibited in the sense of impacting on their efficacy by this South African strain. That's the reason why there will be attempts to develop even other antibodies that might be able to avert this particular problem. So looking forward, what we plan to do in collaboration with the companies is to develop what we would call alternative or boosts that would use the same platform, but that would incorporate a particular immunogen that would address these particular variants. And for that reason, we will always want to be a step or two ahead of what might be a problem in the future.
Pandemic. And there's also the science of it. We cannot beat this virus without making sure we're executing a plan that works for all communities. So we've committed to taking an equity lens to every aspect of this pandemic response. That includes minimizing the risk of getting infected, and for those who get COVID, minimizing the risk of hospitalization or death. So that includes ensuring access to PPE, testing, treatments, and vaccines. It also includes making it possible for people to safely quarantine and isolate and to monitor the impacts of long COVID. So from what the data show us, we still have a long way to go. Latino, Indigenous, and Black people in America are dying at high rates from COVID-19. And folks in rural communities have case and death rates that continue to climb, and they're dying at higher rates than people in metropolitan areas. So by race, ethnicity, sexual orientation, gender identity, disability, geography, based on where you live, COVID-19 is leaving a terrible imprint on far too many communities. Next slide. So the president took immediate action to combat COVID-19 health equities. Last Thursday, President Biden signed an executive order on ensuring an equitable pandemic response and recovery. And a key part of his approach to ensuring equity is through the COVID-19 Health Equity Task Force. So this task force is responsible for providing specific recommendations to the president through the COVID-19 response coordinator for mitigating the health inequities caused or exacerbated by the COVID-19 pandemic, and also for preventing these kinds of inequities in the future. The task force will include individuals with insights into these groups that have been hardest hit. So their role will be advisory in nature, but the president has asked them to make some recommendations on a range of issues. Optimally allocating COVID-19 resources by agencies and by state, local, tribal, and territorial officials. Dispersing COVID-19 relief funds in a way that advances equity. Ensuring effective, culturally aligned communication, messaging, and outreach to our hardest hit communities. And addressing ongoing health inequities faced by COVID-19 survivors that may merit a public health response. So it's going to be essential that we collect data for the hardest hit communities and identify data sources that would enable development of short-term targets for pandemic-related actions, and address longer-term data shortfalls and challenges to better prepare and respond to future pandemics. So we will be announcing the members of this task force soon, as President Biden is adamant they hit the ground running, especially now as so many people and communities are disproportionately hurting from this pandemic. And for the last slide, Finally, it's critical everyone has equitable access to all of the resources necessary to make it through this pandemic. And that includes equitable distribution of COVID-19 vaccines to all communities. So all Americans, everyone in our country, should have the benefit of a safe, effective vaccine that can prevent them from getting sick or dying from COVID-19. It takes intention and deliberate action to advance equity in this vaccine distribution process. So we're going to do that through a series of important actions. We're leveraging data sources, both from government and other sectors, to find and remedy inequities. We're limiting all out-of-pocket costs for vaccines. Your ability to pay should not play a role in your decision of whether or not to receive this vaccine. We're removing structural barriers to access in underserved communities. We'll do this by making sure that it's convenient and accessible to get to vaccination sites, by increasing the clinical and community-based workforce for outreach, education, vaccination, and wraparound services. We're working to make sure that transportation and paid time off are available so people can make it out to get their vaccine. We're going to increase and support core venues of vaccination, including federally qualified health centers. And Andy's going to talk about some of our other venues for vaccination that we're ramping up. But it will be important to make sure vaccine is available for everyone. And oftentimes that will mean bringing the vaccine right to people. So next, we're already talking to states about their pandemic plans and strategies for equity. We're here to provide technical assistance when needed. But when local health officials are making great progress in equity, we're sharing some of those great ideas with their peers around the country. And finally, we're launching a robust national public education campaign to make sure people know about this vaccine, the facts, and not the misinformation. We want people to know that the vaccines are safe and effective. We want everyone to be able to make decisions with the best information possible. And we're going to make sure that the information comes to them in places and in ways that are most likely to reach them. It's critical this public education work be very local in nature. Critical that we in the federal government support the relationships that already exist between faith and community leaders and their communities. So while there is no single way to do this work, there are best practices that must define our approach, and supporting those best practices will be our focus in the days and weeks to come. So there's so much to do to get through this pandemic, and we want to make sure all communities are cared for and supported along the way.